Salam Sejahtera, sir. I'm Cornelia, your Shinyin. Today, I'm going to present about CPR, splinting, and bandaging. Okay, next, we're going to present is cardiopulmonary resuscitation. Okay, next, what is CPR? CPR stands for cardiopulmonary resuscitation. It's a life-saving medical procedure which is given to someone who is in cardiac arrest. It helps to pump blood around the person's body when their heart can't. Next, why CPR is important? There have 6 reasons that why CPR is important. First is CPR can save a cardiac arrest victim's life. CPR is designed to keep oxygenated blood flowing to the heart and brain when sudden cardiac arrest (SCA) occurs. Because the heart can't pump blood, tissue and organ death can occur in minutes without external assistance. You may think it unlikely that you'll ever be required to act in such an emergency, but cardiac arrest can occur at any time. In fact, it's the #1 killer worldwide. Second is most cardiac arrest victims don't survive. The mortality rate among out-of-hospital cardiac arrest victims is about 90%, considering that the vast majority of this event, about 350,000 per year, occurs outside the hospital. This is devastating news. In-hospital cardiac arrests have a much better prognosis because patients are treated swiftly before organ damage occurs. If a majority of persons were trained in CPR procedures and capable of responding to out-of-hospitals emergencies, far more sufferers would survive long enough to receive the professional care they need. Third is CPR can quadruple a person's odds of surviving SCA. CPR saves life. It keeps blood flowing to vital organs while you await the arrival of emergency services. On meta-analysis of 79 studies found that bystander CPR increases a victim's odds of survival by 4 times. The standard survival rate for out-of-hospital SCA is only about 10%, but the survival rate among sufferers receiving bystander CPR is nearly 45%. So that the problem isn't that cardiac arrest victims can't be saved. The issue is that less than 5% of the person is trained in CPR. In most cases, sufferers are left waiting for emergency services, and the longer those services take to arrive, the worse the prognosis. That's why we consistently stress the importance of CPR. Fourth is every minute matters in a cardiac emergency. When you are an untrained or minimally trained bystander, it's easy to assume that you are better off stepping aside and letting the professional works their magic. This is a critical mistake. For every minute that a cardiac arrest victim goes without CPR, their chance of death increases by 10%. Now, consider that emergency professionals take an average of 4 to 10 minutes to respond to an emergency. Assuming you are lucky enough to get professional support in just 4 minutes, but the victim's prognosis has still dropped by 40%. And if it takes 10 minutes for help to arrive, it may be too late. CPR buys you much needed time during those critical minutes, maximizing the victim's chances of survival. Fifth is CPR makes AEDs more effective. If you are lucky, you have access to an automated external defibrillator AED during a cardiac emergency. These life-saving defibrillation devices are often stored in public places like hotels, gyms, church, and office and they're often successful in reviving cardiac arrest sufferers. But even if you have one of these devices on hand, it's still important to understand CPR best practice. CPR improves the effectiveness of defibrillation, and the combination of these two practices can improve survival rates by additional 9%, while the AED works to restore a normal heart rhythm. The CPR works as a stopgap to keep the blood flowing and the organs nourished. You don't want to lose precious minutes of blood flow while retrieving the AED, nor do you want to stop the momentum while waiting for emergency services in the event that defibrillation doesn't revive the patient. Last one is learn CPR because may save someone you love. Importance of learning CPR isn't about memorizing beats per minute or discerning what a 2-inch chest compression feels like. It's about investing in a simple but critical education that may someday benefit someone you love in the event that a loved one falls victim to a cardiac event. You don't want to be a helpless bystander. You have the power to be their lifeline. Don't underestimate the importance of CPR. Learning it is easy and takes little time, but it can make all the difference in the world. Next, what is a cardiac arrest? A cardiac arrest is caused by an electrical problem in the heart. This electrical problem causes the heart to stop pumping blood around the body and to the brain. It causes the person to fall unconscious and stop breathing. Without CPR, the person will die within minutes. CPR should only be used if someone is unconscious and not breathing, and unconscious and not breathing normally. If someone is unconscious but they are breathing normally, call 999 and then put them in the recovery position. Next, is a cardiac arrest the same as a heart attack? No, the answer is no. But both are medical emergency, so you should call 999 immediately. A heart attack happens when an artery supplying blood to the heart muscle becomes blocked. This starves part of the heart muscle of oxygen and causes symptoms such as chest pain or discomfort. A person having a heart attack is usually still conscious and breathing. If a heart attack isn't treated, it can lead to a cardiac arrest. Next, how long should I CPR? Always call 999 before starting CPR. Then keep doing CPR until professional help arrives and takes over, or the person starts to show signs of regaining consciousness. If you become exhausted, take turns with other people nearby. Signs of regaining consciousness include coughing, opening their eyes, speaking or moving purposefully, starting to breathe normally. Stop CPR if the person regains consciousness. If the person starts to breathe normally but still unconscious, put them into the recovery position and pay attention to their breathing until help arrives. Next, CPR steps for adult. First steps is call 999. First, check the scene for factors that could put you in danger, such as traffic, fire, or falling masonry. Next, check the person. Do they need help? Tap their shoulder and shout, "Are you okay?" If they are not responding, call 999 or ask a bystander to call 999 before performing CPR. If possible, ask a bystander to go and search for an AED machine. People can find this in office and many other public buildings. Second step is place the person on their back and open their airway. Place the person carefully on their back and kneel beside their chest. Tilt their head back slightly by lifting their chin. Open their mouth and check for any obstruction, such as food or vomit. Remove any obstruction if it is lost. If it is not lost, try to grasp it may push it farther into the airway. Third step is check for breathing. Place your ear next the person's mouth and listen for no more than 10 seconds. If you do not hear breathing or you only hear occasional gaps, begin CPR. If someone is unconscious but still breathing, do not perform CPR. Instead, if they do not seem to have a spinal injury, place them in the recovery position. Keep monitoring their breath and perform CPR if they stop breathing. Fourth steps is perform 30 chest compressions. Place one of your hands on top of the other and clasp them together. With the heel of the hands and straight elbow, push hard and fast in the center of the chest, slightly below the nipples. Push at least 2 inches deep. Compress their chest at a rate of at least 100 times per minute. Let the chest rise fully between compressions. Fifth step is perform 2 rescue breaths, making sure their mouth is clear. Tilt the head back slightly and lift their chin. Pinch their nose shut. Place your mouth fully over theirs and blow to make their chest rise. If their chest doesn't rise with the first breath, retilt their head. If their chest still do not rise with a second breath, the person might be choking. Last steps is repeat it. Repeat the cycle of 30 chest compression and 2 rescue breaths until the person starts breathing or help arrives. If an AED arrives, carry on performing CPR until the machine is set up and ready to use. Next, CPR steps for children and infants. First, check the surrounding area for factors that could put you in danger. Next, check the child or infant to see whether they need help. For children, tap their shoulder and shout, "Are you okay?" For infants, flick the sole of their foot to see if they respond. If you are alone with the child, they are not responding. Give them 2 minutes of care and then call 999. If there is a bystander, ask them to call 999 while you give 2 minutes of care. If possible, ask a bystander to go and search for an AED machine. Office and other public buildings tend to house this. If the child doesn't respond, call 999 to report any life-threatening conditions. Second step is place them on their back and open their airways. Place the child or infant carefully on their back and kneel beside their chest. Tilt their head backward slightly by lifting their chin. Open their mouth. Check for any obstruction, such as food or vomit. If it is lost, move it. If it is not lost, do not touch it, as this may push it further into their airways. Third step is check for breathing. Place your ear next to their mouth and listen for around 10 seconds. If you do not hear breathing, or you only hear occasions gasp, begin to administer CPR. Change in an infant's breathing patterns are normal, as they usually have periodic breathing. Keep monitoring their breathing and perform CPR. If they stop breathing, fourth step is perform 2 rescue breaths. If the child or infant is not breathing, perform 2 rescue breaths with their head tilted backward and their chin raised. For a child, pinch their nose shut and place your mouth over theirs. Breathe into their mouth twice. For an infant, place the mouth over their nose and mouth and blow for 1 second to make their chest rise. Then deliver 2 rescue breaths. If they are still unresponsive, begin chest compressed. Fifth step is perform 30 chest compressions. Kneel beside the child or infant. For a child, use one of your hand. Place the heel of the hand at their sternum, which is in the center of the chest, between and slightly below their nipples. Press down hard and fast around 2 inches deep, or 1/3 the depth of the chest, at least 100 times per minute. For an infant, use 2 fingers. Place your fingers in the center of their chest, between and slightly below the nipples. Perform 30 quick compression around 1.5 inches deep. Last step is repeated. Repeat the cycle of rescue breaths and chest compress until the child starts breathing or help arrives. Next is the CPR video. Next is splinting. Okay, what is splinting? A splint is a medical device that immobilizes the injured body part and protects it from further injuries. It heals the fractured bones by keeping the broken ends together and in alignment. Splints also reduce pain and swelling. The main purpose of splinting is to immobilize the joint and bones above the below the fracture site. This is prevent bone age from moving the damaging other muscles, vessels, or nerves, and further complications. Splinting will be effective when the adjacent joints and bones remain immobilized. Next, when you should splint application avoided. Splint application should be avoided in the following condition: when open fracture, when the broken bone that tears the skin. Second is impending compartment syndrome, when a potential life-threatening condition in which the pressure builds up in the legs, abdomen, or arms. Third is neurovascular compromise at the malunion of the nerves and blood vessels. Fourth is active or developing reflex sympathetic dystrophy at chronic arm or leg pain, causes due to injury, surgery, stroke, or heart attack. Next, how is a splint applied? Before applying a fiberglass or plastic splints, the caregiver places cotton padding as a protective layer to the skin. Splints come in either stripes or rolls. The caregiver dips the rolls or strips in water and applies it over the padding covering the injured area. Sometimes the caregiver even covers the joint above and below the broken bone. The splint must fit the shape of the fractured arm. or leg to provide adequate support. The caregiver usually applies a splint to a fresh injury. Once the swelling subsides, the caregiver replaces the splint with a cast. Gradually, as the fracture starts to heal, the caregiver may again replace the cast with a splint. Next, what is a splint used for? Splints are applied to treat the following conditions: sprains, fractures, dislocations, control of pain. Carpal tunnel syndrome is a condition characterized by numbness and tingliness in the hand or arm caused by a pinched nerve in the wrist. Complex bone fractures and tendinitis is inflammation of the tissue connecting the muscle and bone. Next, how to apply a splint. First is attend to any bleeding. Attend to bleeding, if any, before you attempt to place the splint. You can stop the bleeding by putting pressure directly on the wound. Second is apply padding. Then apply a bandage, a square of gauze, or a piece of cloth. Don't try to move the body part that needs to be splinted. By trying to realign a mishapen body part or broken bone, you may accidentally cause more damage. Third is place the splint. Carefully place the homemade splint so that it rests on the joint above the injury and the joint below it. For example, if you're splinting a forearm, place the rigid support item under the forearm. Then tie or tap it to the arm, just below the wrist and above the elbow. Avoid placing ties directly over the injury area. You should fasten the splint tightly, even to hold the body part still, but not so tightly that the ties will cut off the person's circulation. Fourth is watch for signs of decreased blood circulation or shock. Once the splinting is complete, you should check the areas around it every few minutes for sign of decreased blood circulation. If the extremities begins to appear pale, swollen, or tinted with blue, loosen the ties that are holding the splint. Post-accident swelling can make the splint too tight. While checking for tightness, also feel for a pulse. If isn't faint, loosen the ties. If the injured person complains that the splint is causing pain, try loosening the ties a little. Then check that no ties were placed directly over any injury. If this measure don't help and the person is still feeling pain from the splint, you should remove it. The injured person may be experiencing shock, which might include them feeling faint or taking only short, rapid breaths. In this case, try to lay them down without affecting the injured body part. If possible, you should elevate their legs and position their head slightly below heart level. Last is seek medical help. After you have applied the splint and the injury body part is no longer able to move, call 999 or your local emergency services. You can also take your loved one to the nearest urgent care clinic or emergency room, ER. They'll need to receive a checkup and further treatment. Next, splinting the hand. The hand is an especially difficult area to immobilize. Here are some tips for making your own hand splint. First step is control bleeding. First, treat any open wounds and control any bleeding. Second step is place an object in the palm of the hand. Then place a wad of clothes in the palm of the injured person's hand. A washcloth, a ball of socks, or a tennis ball can work well. Ask the person to close their fingers loosely around the objects. Third is apply padding. After the person's fingers are closed around the object, loosely place padding between their fingers. Next, use a large piece of clothes or gauze to wrap the whole hand from the fingertips to the wrist. The cloth should go across the hand from the thumb to the pinky. Fourth is secure the padding. Secure the cloth with tape or ties. Make sure to leave the fingertips uncovered. This will allow you to check for signs of poor circulation. Last step is seek medical help. Once the hand splint is on, seek medical attention at an ER or urgent care center as soon as possible. Okay, next is the video of splinting the hand. Last is bandaging. Okay, what is bandaging? Bandaging is to cover by wrapping with such material. Bandages may be used to stop the flow of blood, absorb drainage, cushion the injured area, provide a safeguard against contamination, hold a medicated dressing in place, hold a splint in position, or otherwise immobilize an injured part of the body to prevent further injury and to facilitate healing. Next, what is the purpose of bandaging? A bandage is used to hold a dressing in place over a wound, to create pressure over a bleeding wound for control of hemorrhage, to secure a splint to an injured part of the body, and to provide support to an injured part. Okay, next, how important is bandaging in first aid? It is important to do the proper bandaging technique when using and administering first aid on a wound or injury. The main goal of placing a bandage on an injury is for immobilization, protection, support, or compression. If the bandaging technique is not done properly, it could exacerbate the damage. Next, what are the principles of bandaging? Bandages are great for providing an environment which support wound healing, as well as protection for the wound from contamination and flies, observe of wound discharge, and reduction of limb swelling and limb movement. Next, what are the types of bandaging? The main type of bandaging is gauze bandage, compression bandage, triangle bandage, and tube bandage. Next, what is the steps of bandaging? The first step is dress the wound. Put on gloves or use other protection to prevent contact with the victim's blood. Clean the wound with mild soap and water. Apply a small layer of topical antibiotic if desired. Place a clean dressing over the entire wound. Gauze dressing let in air for faster healing. Non-stick dressing have a special surface that won't cling to the wound. If blood soaks through the dressing, place another dressing over the first one. Second step is cover the bandage. Wrap roller gauze or cloth strips over the dressing and around the wound several times. Extend the bandage at least an inch beyond both sides of the dressing. Don't wrap the bandage so tight that it interferes with blood flow to healthy tissue. Third step is secure the bandage. Tie or tap the bandage in place. Don't secure the bandage so tight that fingers or toes become pale or blue. Last step is check circulation. Check circulation in the area below the bandage after several minutes and again after several hours. If circulation is poor, the skin may look pale or blue or feel cold. Sign of poor circulation also include dampness and tingling. If circulation is reduced, loosen the bandage right away. If symptoms continue, get medical care. Next is the video of bandaging.